Hello, my name is Alexandra, and I'll be doing this case presentation for Module 4. Miss A.S. is a 28-year-old white female student and retail worker who presented with complaint of feeling unlike herself and that she was going crazy around her periods. History of present illness. Patient complaints feeling unlike herself around her periods for the last 6 months. She recently, 3 months ago, had a Mirena IUD placed for birth control and heavier bleeding. Her last menstrual period was February 1st. She states that with the Mirena, her periods have been regular and lighter, lasting 3 to 4 days and requiring 3 tampon changes a day. And that when they occur, she says she feels moodier and easily angered 2 to 3 days prior to the start of her cycle and feels better 2 to 3 days after. She had a recent diagnosis of manic bipolar disorder, for which she is taking clonazepam and Seroquel, and Prozac for her diagnosis of anxiety. She reports that neither of any of these medications have alleviated her symptoms. Past medical history includes manic bipolar disorder and anxiety. She denies any known family history. She has allergies to sulfa, reporting an anaphylactic reaction. Social history, she denies smoking, doing drugs, or alcohol use. She denies exercising, and she denies any history of self-harm or attempted suicide. Current medications she is taking include Prozac 20 milligrams nightly, clonazepam 0.5 milligrams BID, Seroquel 300 milligrams daily, and melatonin 5 milligrams nightly. Constitutional symptoms, she denies any fatigue, fever, chills, malaise, night sweats, or unexplained weight loss or weight gain. She reports for psychiatric symptoms, mood changes, that she's easily angered, and that she has anxiety around her period. She denies any nervousness, insomnia, suicidal thoughts, or any exposure to violence. And neurologically, she denies any weakness, numbness, muscular weakness, tingling, history of any syncopal episodes, strokes, or seizures. On physical exam, she appears well-developed, well-nourished, and mildly anxious. She reports that she does not appear currently depressed, suicidal, or agitated. No diagnostic tests were performed, and for our diagnosis, we came up with premenstrual dysphoric disorder. Management of this included we started the patient on Yasmin. She currently takes Prozac for anxiety symptoms and the clonazepam and Seroquel for her manic bipolar disorder, but since these are not relieving her symptoms, according to the literature, second-line treatment for PMDD would include a new form of birth control, and since the Mirena is progesterone only, we started her on an oral birth control that included a component of estrogen to help relieve those symptoms, since this is considered a second-line treatment since the Prozac was not working. We also encouraged her to add exercise to her daily and weekly routines, as this has been shown to help with premenstrual dysphoric disorder. So in summary, she presented as a reliable historian with complaint of mood changes, feeling crazy and unlike herself. Patient recently diagnosed with manic bipolar disorder and reports that these symptoms have not been improved with medical treatment, and that the symptoms are around her period are unimproved with anxiety medications and her IUD. We came up with a diagnosis of PMDD due to the timing of her symptoms. She was started on an oral birth control containing a low dose of estrogen to help improve her symptoms, as well as encouragement of daily exercise.